Chris, and today I'm reacting to the Marc Marquez crash of 2020. Your humorist does not like direct, blunt trauma. Marc Marquez, professional MotoGP motorcycle racer, and his recent arm injury at the Spanish GP help us to understand why. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. If you are here because you recently subscribed to my channel, then thank you for becoming part of the intern army. Welcome to my channel, where I explain orthopedic injuries and sports medicine in a way that's easy to understand for everybody.
Ladies and gentlemen, can I please have your attention?
Although I can hardly believe that I am saying this, today I am talking about Marc Marquez and the injury that he sustained on July 19, 2020 at the Spanish GP in Jerez, Spain. This race was the first event of the shortened 2020 season after MotoGP returned to racing following the first wave of the COVID pandemic. With a drastically shortened season, there was more pressure than ever on the racers to avoid mistakes and to finish strong, as every single point gained or lost would be significant. The 8-time world champion Marc Marquez had proved to be fast during the week of practice, but not quite fast enough, as he was slated to start from 3rd position. And if you know anything about Marc Marquez, you know that he likes to lead the race on every freaking lap. It was a certainty that he would be gunning for the lead from the moment the starting lights went out. As the race started, Marquez made a good start, picking up 1 position by the first turn. While in 2nd place, he waited for only 1.5 laps before he attacked Maverick Vinales to take the lead. And for the next 2 laps, it looked as though things would proceed as they had for the last several seasons, as Marquez began to pull away from the pack, extending his lead. However, on the 4th lap, Marquez made a mistake. For most other riders, this would have been a crash and the end of their race. But for Marquez, it was just another day in the office. Marquez low-sided in turn 4 and ran wide into the gravel trap, but managed to regain control and eventually return to the track in last place. So now the game was truly on. Over the next 16 laps, Marquez sliced and diced, kind of like a Ginsu knife, his way through the entire MotoGP pack until he was actually in podium contention by lap 20. It was at this point his luck ran out. At the start of the race, Marquez had chosen the hard tire compound for the front and the soft tire compound for the rear tire. The soft tire, although grippier, had a shorter life than the hard compound tire. As a result of his off on lap 4, Marquez had pushed his tires hard over the first 20 laps of the race. His hard pace had affected the rear tire considerably more than the front tire, leaving the rear tire questionable under acceleration. While in 3rd place, as Marquez exited turn 4, he accidentally spun up the back tire, causing a high side and another off into the gravel trap without any hope of being able to save it. Whether you are on pavement or on dirt, everyone knows that high sides hurt. Marquez was thrown over the right-hand side of the bike onto the pavement as his bike tumbled behind him. He slid into the gravel trap and was struck by the bike as it followed behind. He did not lose consciousness and he was able to walk out of the gravel trap unassisted. However, as he sat trackside, his facial expressions made it clear that he was in a whole heap of pain. It appeared that he was also favoring his right arm. Marquez was stabilized trackside and then taken to the infield medical center on a backboard and with a cervical collar. After Marquez was examined in the medical center, a MotoGP physician reported that he had suffered a humerus fracture during the crash. He noted that injury to the radial nerve might also be possible, but had not yet been confirmed. He also reported that Marquez would undergo surgery the following day to stabilize his fracture. So what happened to Marquez in his crash? What are the injuries that he suffered? How will he be treated when he undergoes surgery? And what will be in store for Marquez for the remainder of the 2020 MotoGP season? Marquez was thrown over the right side of his bike and he landed on his left side on the pavement before sliding into the gravel. The front tire of the following bike struck Marquez in the side of his right arm, which caused him to start tumbling through the gravel trap. He came to a rest on his knees, but did not appear to put weight on his right arm. The replay of the accident shows that his arm began to flail immediately after he was struck by the motorcycle tire. With the telemetry showing that Marquez went off the track at a speed of approximately 150 kilometers an hour, or 93 miles per hour, and the minimum weight of a MotoGP bike being 157 kilograms or 346 pounds, you can imagine that this might deliver enough force to cause a fracture with a direct blow. The MotoGP physician reported that Marquez had suffered a fracture of his humeral shaft as a result of the contact with the tire. Given that this was a direct blow, we can guess that the fracture is likely to be a transverse fracture, or directly across the shaft. Based on the replay, it appears to have occurred at the level of the mid-shaft of the humerus, or the middle of the shaft. This fracture likely has 2 fragments, or 3 fragments, with one being a smaller butterfly fragment, as this is the pattern of fractures that is usually observed with direct blows, such as with a nightstick fracture. The fracture was described as being complete but not significantly displaced, so we know that the fragments have not moved very much from their anatomic position. However, the physician reported that there was a possibility of an injury to the radial nerve. Apart from confirming the potential location of the fracture at the mid-level of the humerus, this tells us that there must have been some displacement of the fragments at some point since the radial nerve was disturbed. Normally, the radial nerve runs quite closely around the back of the humerus at the level of the mid-shaft. It can be injured when the fracture fragments become displaced and either stretch the nerve or lacerate the nerve. If the humerus fracture is closed, the potential injury to the radial nerve is typically a neuropraxia, or a minor injury to a nerve that remains in continuity. These injuries usually resolve within 1 year with restoration of normal function. If, however, the humerus fracture is open, where the bone protrudes through the skin, the potential injury to the radial nerve may be more serious, where the nerve is lacerated or even completely severed. These injuries are known as axonotmesis and neurotmesis, respectively. If these injuries have occurred, Marc will have a deficit or loss of function of the radial nerve. This will leave him with weakness in elbow and wrist extension and with altered sensation on the back of his arm and hand. Dr. Mir, the MotoGP traumatologist, is slated to perform the surgical stabilization of the humerus fracture on July 20th. The approach and the stabilization utilized for fixation of the fracture will be determined by the characteristics of the fracture itself, including its location and its degree of fragmentation. Once stabilized, we can expect that the fracture will heal over a period of approximately 6 to 8 weeks. Normally, the patient would refrain from vigorous activity during this period of time in order to minimize stress on the surgical implants and to expedite healing. However, Marc Marquez is a professional motorcycle racer. He is an 8-time world champion MotoGP athlete in the prime of his career, competing in a shortened race season. Somehow, I don't think he is waiting 6 to 8 weeks to return to anything. MotoGP medical director Dr. Chart has already stated that Marc Marquez could be back within a couple of weeks. This is definitely not what the doctor has ordered, but he is competing at the highest level and getting paid handsomely to do it. You can't let a little humerus fracture stand in the way of global domination. Like, it's a flesh wound. I will be sure to keep my eye on the situation to see when Marquez will make his return to the track. Knowing what I do about motorcycle racers, I suspect that we will be seeing Marquez back on the track within only a few weeks, possibly with a functional brace to lend support to his surgically stabilized humerus fracture. Depending on the status of his radial nerve, he may or may not also be wearing a functional wrist brace that would assist with any weakness that is present at the wrist level. But whatever the outcome, this is sure to make the 2020 MotoGP season all the more exciting. I wish Marquez well on his recovery from this brutal injury. If you enjoy what I do and the information that I provide, then you can support me by either becoming a member or by checking out my Patreon page, where you will be able to access additional content and interact with me more closely. YouTube doesn't seem to like injuries, and my videos are often demonetized. If you enjoy podcasts and you haven't already, be sure to subscribe to my podcast channel, where you'll be able to catch some really dope interviews. The link will be down in the description. And if you're looking for exercises, workouts, or you want information on injury prevention, be sure to check us out on our sister channel here on YouTube, Human 2.0. Thanks for watching, and as always, that's been a word from Dr. Chris, not your everyday ortho.